Good day. My name is Fowokan, and I am from the Hospital for Sick Children in Toronto. And I'm here to present my submission titled The Impact Assessment of a 12-part Health Research Methods course on Pediatric Oncologist Trainees in 6 Sub-Saharan African countries. Just a bit of a background, the disparities in childhood cancer outcomes observed in low and middle-income countries are well documented. Now, although the reasons for this are multifactorial, the paucity of specialized healthcare and professionals in low and middle-income countries, and a shortage of good quality homegrown research to identify and address challenges to improving survival outcomes are major contributing factors. For this reason, this study sought to evaluate the impact of a 12-part research methods course in improving the research knowledge of pediatric oncologist trainees across Ghana and 5 other sub-Saharan African countries. Between May and October of 2020, we delivered a bi-weekly 12-part research methods course to pediatric oncologist trainees in Ghana and 5 other countries virtually using Zoom. And these courses included an introduction to research design. We covered causation, bias, and confounding. We talked about how to search the literature and how to conduct systematic reviews. We covered the descriptive and observational studies in one lecture. We covered experimental study design in another. We talked about qualitative and mixed method studies. We covered data capture, data validity, and data management in one lecture as well. We talked about research ethics, health policy, and economic studies. We had an intro to statistics course that covered basic descriptive statistics, and the second statistics course that went in depth into analytical methods in statistics. And we also discussed how to publish and disseminate your research. Before each lecture, trainees were asked to anonymously complete 3 pre-evaluation questions. Now, an aggregate set of the same questions were sent to the trainees midway into the course. So aggregate questions from lectures 1 to 6 were sent midway into the course at the end of the lecture on week 6. And at the end of the course, we also sent an aggregate sort of post-evaluation questions from week 7 to week 12 at the end of the week 12 lecture. And the same post and pre-evaluation questions were sent to participants. In addition to the pre and post-evaluation questions, trainees were also sent post-satisfaction surveys after each lecture. And the surveys included self-statements like the objectives of the lecture were clear, the materials used for the lecture were helpful, the objectives of the lecture were achieved, the presenter was well prepared, the presenter stimulated enthusiasm in learning the topic, the presenter facilitated a positive learning environment, the presenter asked effective questions that improved my understanding of the topic, the presenter provided clear explanations, and the responses ranged from strongly agree to strongly disagree. So strongly agree, neutral, disagree, and strongly disagree. We used descriptive statistical analysis to summarize the findings from pre and post evaluation assessment. We then used independent t-tests to compare differences in pre and post evaluation scores. In addition, we summarized post-satisfaction survey scores using descriptive analysis. We found that the mean attendance for the bi-weekly lectures was about 25 for every lecture, and the mean completion rate for the pre-evaluation questions was about 46%, while the mean completion rate for the post-evaluation questions was about 40%. Overall mean post-evaluation scores, which was 1.98, with a standard deviation of 0.89, was found to be generally higher than the mean pre-evaluation score, which was 1.79 with a standard deviation of 0.94. However, the observed differences were not statistically significant. In addition, findings from post-satisfaction surveys, in which for each item in the survey, most students either selected strongly agree or agree, demonstrated broad satisfaction with the course content and delivery. In conclusion, our findings suggest that there is potential utility in a broadly encompassing research methods course in improving the research knowledge of pediatric oncologist trainees in low and middle income countries, and that there is significant appeal for such a research intensive course among medical trainees. Thank you.